We return to our top story, and the Health Secretary's admission that NHS errors with missed breast cancer screenings may have shortened the lives of up to 270 women.
Our current best estimate, which comes with caveats as it's based on statistical modelling rather than patient reviews, and because there is currently no clinical consensus about the benefits of screening for this age group, is that there may be between 135 and 270 women who had their lives shortened as a result. I'm advised that it is unlikely to be more than this range and may be considerably less. However, tragically, there are likely to be some people in this group who would have been alive today if the failure had not happened.
So, it's the NHS failing women. Dr. Kishan Rees is an NHS doctor, and he is with us now. Are we failing women when it comes to breast cancer screening?
Okay, so I think certainly these women have a right to feel that they've been failed, and they've paid into the system for years, and then at the point when they need it, they've been let down. But it's not just women. I think it's lots of groups of patients that are being let down by ultimately successive governments that are not doing the best by the patients that are paying their national insurance contributions.
What should they do differently?
I think they should listen. I think we should have open debate, and they should listen to healthcare professionals. It's been very difficult in terms of doctors and nurses speaking out, whistleblowing. They basically get shut down, and there's a really bad culture in the NHS in terms of that. So I think we need to be mindful of other inquiries and applying learnings from that. So it is positive that an inquiry has been announced. But will it be kicked into the long grass? And I think the one positive from the junior doctors contract dispute is you've now got thousands of doctors, nurses that are politically alive and aware. Groups such as Doctors Association UK, the Political Mess, these are really powerful groups which will empower patients and hopefully institute positive change.
So what should patients be doing? What should clients, whatever you want to call them, be doing if they're going specifically back to this point? If they didn't get the call, to what extent do we have to accept responsibility for our own health?
There is an element of that as well. And I spoke to the lady in makeup and saying, what should we do and what should patients do and things. But it's difficult, isn't it? Because if you're constantly getting messaging from don't go to A&E, it's overstretched, don't get involved, don't go attend A&E, don't go to see your GP, members of the public listen to that messaging. So I think there is an element of personal responsibility. But I don't think it's enough just to let that be the case for these women that have been let down ultimately by this. I don't think it's acceptable to turn around and say yes, it's personal responsibility for those women.
It's not always about money though, is it? This wasn't about money.
This was a computer glitch apparently. The interesting thing, it's been going on for a long time. And it hasn't come to light. The first came into existence or into public knowledge in January, and it's now May, so that's quite a long period. But this has been problems over years, and I think we need to look at the bigger picture, the bigger problems, the culture, in terms of were people concerned about speaking out, about issues, maybe not this one, they might not have known about this one, but people are definitely concerned about speaking out. We need a culture where people that speak out are celebrated in terms of patient safety and champions of that, rather than isolated, marginalised.
Why do you think people don't speak out?
I think it's difficult, and I think there's a interesting culture in the NHS. Some managers are very receptive to it, some managers are not. And I think ultimately, if your livelihood gets put on the line, and you run the risk of losing your job, as we've seen in the case with Dr. Chris Day, who's a whistleblower, and patient safety, then it puts people off in terms of speaking out. It is difficult, but I think, as I said, we've got thousands of doctors now that are wanting to speak out for the benefit of patients, and I think that's really important.
But medical professionals should also, their first concern should be their patients. Should doctors on all levels not have picked up on the fact that a 70-year-old woman who, is probably going to be presenting at the GPs with other issues as well as not having had their screening, should that not have been picked up?
There's an element of that, of course.
So when she comes in for whatever reason, it's like, you've not had your screening.
There's an element of that, but the system is so pressured, and the system is 8-minute appointments for GPs. I think partly the medical profession, part of it's our fault for not speaking up. So I don't think the NHS has failed patients. I think if doctors and as a profession, I think we should probably speak louder for our patients. And in a perfect system, you would love to go and see a GP and say, Mrs. Jones or whatever, you haven't had your screening, let's sort that out. But I think if you talk to many GPs, they're struggling and their backs are against the wall, and it's incredibly stressful, the environment that they're working in. If you have an adequately funded health service where there's lots of resource going into it, then that would be the case. But with these ladies that are going to be called back from the screening, we need to make sure there's adequate resource for these women to get seen appropriately and it doesn't impact elsewhere in the service.
Do you accept that the National Health Service isn't fit for purpose though anymore? It is a
not.
bottomless pit, and it needs to be changed to better facilitate those who need it most.
Okay, so there's a little kind of heads up. What you're going to see, what's going to happen now is people are going to say, let's have a cross-party consensus. Let's depoliticise the NHS. Let's get a cross-party consensus. And I think if you have MPs and Lords on that committee that have no financial incentives, as in shares in private healthcare companies, then sure, great, let's have that discussion. But when you see massive changes undergoing in the NHS in terms of accountable care organisations and integrated care systems, which we're not even sure what the legal basis for those are yet, and you get private companies able to bid for those contracts for 10 years, then I don't think it's a fair discussion. I don't think it's a fair debate. And I think what we need to do is we need to hold politicians accountable and say, actually, we're paying for this service, and this is the service that we want as patients and as members of the public. And you're a taxpayer, you pay your taxes. Ultimately, when I'm working as an NHS doctor, you're paying my wages. So even though it's difficult to speak out, I feel there's an obligation and I feel I have to.
Okay, good to talk to you, Doctor. Thanks for coming in.
Cheers, Kate. Thanks.
Thanks a lot. Let's take you.